Hi everyone, my name is Luke Nyan T, and today I'm going to share with you my job experiences as a pharmacist. And this will be the outline of my presentation today. So about me, I graduated from the University of Strathclyde in 2016 as part of the International Medical University and University of Strathclyde Twinning Program. Then I started working in April of 2017 in Hospital Jengka, Pahang as a contract staff. Then I was posted to Hospital Kanawit Sarawak for my compulsory service. After that, I was absorbed as a permanent staff and was posted to Klinik Kesihatan Belaga Sarawak, and I remained there until today. So Hospital Jengka and Hospital Kanawit are both district hospitals, and Klinik Kesihatan Belaga is a small health clinic. So as you can see, my work experience has been largely confined to smaller facilities. So do keep that in mind as you listen to my sharing. So, how did I decide to become a pharmacist? 10 years ago, I was in your position as well, fresh out of SPM and trying to figure out what the next move would be. So, for me, it was a decision made by elimination. Since my secondary school years, I wanted to work in healthcare and nothing else interested me. In healthcare, there are so many different career options, but in my mind, I only wanted to do what I thought was interesting in healthcare, which were medicine, dentistry, and pharmacy. And how did I choose between these three again? By elimination. So medicine to me was sort of top tier, and for most of my secondary school years, the plan was to study medicine. But during SPM, I was quite stressed out, and then I decided that medicine was not right for me. So that leaves me with dentistry and pharmacy. And at the time, I was getting my braces done for my teeth. And that meant I had many visits to see a dentist. And I felt that their job didn't really appeal to me that much. I didn't like the idea of staring into people's mouth all day. So that left me with pharmacy. So I'll pause here and say that I wouldn't recommend this approach to decision making. I decided by elimination, but I eliminated the options that I knew more about, and that left me choosing the option that I knew least about. So it's good that you're attending this talk today so that you can make an informed decision. So let's talk about influences. When I finished SPM, my parents gave me the freedom to choose whatever course I wanted to pursue. And when I say freedom, I mean freedom. There were really no restrictions from them. But despite that, I would still say that my parents were the biggest influence on my career decision. I believe that my parents' relationship with their work was an influence on my career decision. So growing up, I saw that my parents gained stability, comfort, and purpose from their work, which was in the teaching field. So it was only natural that I sought the same thing from my choice of career. At the time of my decision, which was 10 years ago, pharmacy was an occupation that was in high demand. So to me, that meant that a pharmacy degree would grant me stability in terms of having a job. I also knew that pharmacists were paid a decent salary, and with a decent salary, I could have a comfortable lifestyle. Working in healthcare would also mean improving the lives of others, so there would be some sense of purpose in my job. So although my parents were not working in healthcare, I looked for the same things that I perceived they had gained from their work. But it's important to consider that work is more than stability, comfort, and purpose. Work can also be a means of achieving a childhood ambition or realizing a dream. It can be a form of self-expression. It can be a passion or a way to channel creativity. And these are things that I only considered when I was halfway through my degree. So it's possible that I would have taken a different route if I had considered this earlier. And I hope you consider these as well as you make your decision. These are the consultations that I made before embarking on my degree. Both pharmacists were friends of my parents. I think that most pharmacists would be quite willing to have a student observer over at their premises. So even if you don't know one personally, I would encourage you to approach a pharmacist to ask. I would recommend definitely staying longer than half a day. I think that in my short half a day, I did get some information, but I would have benefited more from observing a week or longer. So what am I doing now? Currently, I'm a pharmacist in a government health clinic, aka Klinik Kesehatan, and I work in an outpatient pharmacy. To keep things simple, it can be said that everything I do as a pharmacist has some relationship to the 5 R's that you see on my slide. The first R is the right patient. This means that the medication is being given to the right patient. We usually confirm patient's identity every time before dispensing to them. Then the second R is the right drug. Here we make sure that the medication prescribed is the medication that the patient receives. We also need to consider the patient's medication history, drug allergy history, and drug-drug interactions. The third R is the right dose. We have to make sure that the prescribed dose is within the allowed range and that the patient receives this dose. The fourth R is the right route. A drug can be delivered orally, rectally, topically, sublingually, by inhalation, or injected. And we must make sure that the correct route is used. The fifth R is right time. Some medications need to be taken after food. Some medications need to be taken on an empty stomach. Some drugs are best taken in the morning, and some are best taken at night. So now for the details of what I do every day. Most of my day is spent doing what I call counter duties. In a clinic, the patient visits the prescriber first, which may be a doctor or a medical assistant. The prescriber then writes a prescription for the patient. The patient then comes to the pharmacy with the prescription in hand. So the first thing I need to do is screen the prescription. First, I look at the patient's age. If the patient is a child, then I need to counter-check the doses against the patient's weight to ensure that it is suitable for the patient. Next, I look at the patient's diagnosis to know what the prescribed medications are for. Then, I check the prescribed medications and their suitability for that diagnosis. Then I check the doses of those medications and make sure that they are correct. Finally, I check the patient's details for any history of drug allergy. The next step is transcribing, where we move the patient's medication details from a physical system to a digital database. This allows us to print labels for the medications, but more importantly, it allows us to trace back the patient's medications in the future if that becomes necessary. The need would arise, for instance, if a patient under follow-up in my facility is warded or seeks treatment in another facility without bringing previous medications or medical records. A pharmacist from that facility can contact me to trace the patient's medication record. During filling, the correct medications in the right quantity are packaged and labeled. Usually those medications will be counter-checked to ensure that the 5 R's that we talked about earlier are fulfilled, and then passed to the counter for dispensing. Dispensing is where I give medications to patients. If the patient is taking a medication for the first time, I need to educate the patient on the use of the medication, the dose, the timing with regard to food, and common side effects. Intervention is when I detect errors in prescribing. This includes, but is not limited to, doses that are out of normal range, changes in medication and doses that are not intentional, incomplete patient details, an unsuitable drug, for example, a patient that is pregnant but is prescribed with a medication that should not be used in pregnancy. I will then send the prescription back to the prescriber for correction. The bulk of my time is spent doing these so-called counter duties. So the rest of my day is spent on other things, for example, data collections. We need to gather certain data on a regular basis, for example, daily prescription counts, waiting times, medication errors, and usage of certain medications. These are then compiled and sent as part of our monthly or quarterly reports to our headquarters. We also have a system called the Centralized Medication Dispensing System. This service caters to patients that are under follow-up in a hospital or clinic that is far from their home. So let's say there's a patient that is from Syrian. Hospital Syrian may not have the expertise to treat this patient, so the patient is then referred to Sarawak General Hospital. The patient then receives a 4-month prescription from Sarawak General Hospital. So in government facilities, medications are usually supplied 1 month at a time. So the first month is collected from Sarawak General Hospital, then the patient can request the pharmacist to arrange for the remainder to be collected from Surian Hospital. So as pharmacists, we also receive these orders and help to arrange for the medication to be moved to the facility closest to the patient. My other duties are listed as below. Adverse drug reactions are an unintended and unwanted reaction to a medication. All of these are documented and kept in a nationwide database. If a medication error occurs at the clinic, I document them and report them. In root cause analysis, I sit down with other members of the pharmacy team and we analyze our medication errors and look for ways to prevent them in the future. And if patients have an allergic reaction to a medication, we issue allergy cards to them. So let's talk about skill set. Academic qualifications are standard. Regardless of which field you are in as a pharmacist, you will need a degree in pharmacy that is recognized by the Pharmacy Board of Malaysia. You will need to pass the pharmacy jurisprudence examination. This is an exam that tests you on your knowledge of pharmacy laws in Malaysia. Then you will need to complete a year-long training as a provisionally registered pharmacist. Academic skills, you will need to have resource utilization skills. So what does this mean? On a daily basis, as a pharmacist, you'll receive questions about medications from members of the public and from prescribers. Some of these questions can be answered from your own knowledge. However, sometimes you will receive a question that you do not know the answer to. So you'll need to use resources such as books, leaflets, or phone apps. Apart from this, you'll need to be able to perform basic calculations. For example, calculating doses for medications that are dosed based on weight. You will also need to have some basic computer skills to collect data and publish reports, as well as operate the pharmacy software. Attitude. As a pharmacist in a hospital or clinic, you need to be able to work in a team. In my current posting, I work with pharmacy assistants, doctors, medical assistants, and of course, other pharmacists. So you need to have a team-based mentality and be able to see your work as part of a system. So what does system mentality mean? When I talk about system mentality, it means that in our work, there are no heroes, no villains. It's just everyone playing their own role to make the system work. And when errors happen, we don't blame individuals, but we look for ways to improve the system. So apart from being able to work in a team, self-motivation is important. Continuous learning and keeping up to date with the latest practice is your own responsibility. You should also have a curious mind and desire to improve yourself so that you can serve your patients better. Lastly, you need a positive mindset. You will face challenges, and that's typical for any job. But with a positive mindset, you'll be able to find a solution, whatever the challenge may be. In terms of behaviors, as a pharmacist, you must be accurate to minimize errors. This is important for patient safety. Also, you need good communication skills to communicate with your team and with your patients. You also need to be organized to handle the different tasks that you need to complete daily. Okay, now for job challenges and satisfactions. Some of the challenges that come with my job would be challenging patients. Patients' visit to the pharmacy is usually their last stop after a long day at the clinic. Some patients can get quite irritable and impatient. Some prescribers can be challenging to work with. Different prescribers react differently to pharmacists pointing out their errors. Some are grateful, while others can be defensive, and some even get angry. But when it comes to dealing with challenging patients or prescribers, if you have good people skills and good communication skills, it becomes quite easy to deal with them. The good thing about this job is if you have a learning mindset, it will really train your people and communication skills. There's also time constraints and limits to involvement. If you're working in a busy pharmacy with many patients, you may find yourself rushing to meet the dispensing time targets or rushing to clear off patients. Sometimes you may feel that if you had a bit more time to counsel your patients, you could do more for that patient's health. But yes, there are limitations to what you can do. And at the end of the day, you need to be happy with doing your best with the time that you have. Finally would be rural posting. As a government servant, you can request a certain city and a certain facility. However, your posting uh, will depend on supply and demand for pharmacists in the different cities and towns in Malaysia. And more often than not, there's less supply of pharmacists in rural areas and an oversupply in bigger cities. So there is a possibility, as has been the case in my career, that you'll need to work away from your hometown. If you're adventurous and you like moving around, then this may be a good thing. But if you want to settle down with a family, then this becomes a challenge. That said, usually you'll be able to get back to your hometown. Satisfaction. Personally, for day-to-day work, the main thing I find satisfying is medication counseling and medication reviews with patients. That's the time when, as a pharmacist, I think that I have some positive impact on patients. Apart from that, I enjoy the regular hours that my job provides. I don't have night shifts, so 8 to 5 is always a nice schedule to have. Also, I enjoy working with my team. When you are in a rural posting like me, your pharmacy team is your main daily social interaction. I have a good relationship with my team, and that makes my work enjoyable. So, in summary, yes, I'm happy with my job, and I have no plans to change now. Perhaps in the future, I'd like to try my hand part-time in retail pharmacy once I can transfer out of my current posting. Okay, so let's talk about salary and progression. After 3 years of work, my current salary is about 5,000 ringgit. In my line of work, salary progression is time-based on the condition that your yearly targets are met. As for further training, after several years of service, you can apply to take time off to do a master's program. Alternatively, you can also be trained in specific fields, for example, blood thinning medication or diabetes. And this training is provided by more experienced pharmacists. So, the biggest question of all, am I happy? This is a hard question to answer. The saying that I've never had to work a day in my life because my job is my passion is not true for me. But I would say that overall, I'm happy with my work. I'm satisfied with my compensation and quality of life. In my current posting, I find that my role is more of a supporting one, and I quite enjoy that. Okay. It would have made a massive difference knowing the actual role and day-to-day duties of a pharmacist. I'm not sure if knowing what I know now would have changed my choice of career. What I can say is that whatever ideals I had about serving as a pharmacist would have been corrected if I knew more. So my advice to you would be spend as much as time as you can with an actual working pharmacist in the field of pharmacy that you are interested in before you take up this job. Take time to compare your ideals to what they do on the job, and only when you are certain that you have a good idea of what this job is about, then make your decision. Also, if you have other interests in other career options, then go ahead and learn more about that career. Speak to people in that line of work, spend time observing them, then decide. So that's all from me. If you have any questions, you can raise them in the question and answer session. Thanks for listening.